So now that we determine one area in the spine where we have a nervous scope or meter reading, we're going to detail that area with two other things, one called static palpation, which is feeling the spine without the patient moving, and then motion palpation, which is feeling the spine while the patient's moving. You can see here in the spine I have a black mark here where we got our meter reading. So the first thing I do is I glide my fingers along the side of the spine and I feel for what's called a pit of edema. And that'll be at the spots. We're correlating information here as far as where in the spine we have a vertebral subluxation, which is where we have nerve impingement or nerve pressure causing pain or malfunction. And I'm looking for correlation to that area. And then I'm also looking for, within that, if there's a particularly sensitive spot at the level of the break or meter reading as opposed to other spots. So typically ask the person if they're tender there.
Very tender, yeah.
And what about this one here?
It's fine.
Not as bad. And then what about here? So now we've got good information that this is the particular area that's a problem. The next thing we do is take the spine and put that through a range of motion, which is we're feeling for the spinal movement at one area to be normal or the way it should. And if it's abnormal, which I'm finding here in this left bending as opposed to right, where you get free, complete movement, and this way where we feel like it gets a little locked or stuck, that again illustrates that we have the problem here. So we've got three pieces of information: meter reading, static palpation, and motion palpation.